In South Africa, health officials are worried that despite free HIV medication available to prevent mother-to-child transmission, babies are still being born with HIV. This is happening in one of the richest and the most developed areas of the African continent. Here's the detailed report.
In South Africa's Gauteng province, which includes Johannesburg and capital city Pretoria, 232 babies were born with HIV in the first half of this year alone. Doctors are worried and find this concerning.
We are concerned that there is still continuous transmission and babies that are still testing positive for HIV. We were hoping that these numbers would be as close to zero as possible. Even though annual targets have been set and we are within the targets, we do still find it very concerning that in this day and age, with all the preventative programs that's available free of charge at our clinics, that we are still finding babies testing positive.
Mapule Radabe is among the women who have benefited from medical treatment to avoid passing on HIV to her children. In 2015, she tested positive for HIV and was soon receiving antiretroviral treatment. She was concerned about the possibility of having children born with HIV, but learned that the transmission of the virus could be prevented.
After I gave birth, I still continued medication, but then also my daughter, she had a certain medication just to prevent us infected. But it was not for long. Will I stop? I think after 6 months, then that's when she stopped. Mara, she was taking the nurses test just to check positive or negative, but she came all right. She was negative.
Mother-to-child transmission of HIV globally remains a concern for UNAIDS, which estimates that there are 120,000 new infections annually in children aged 14 years and younger around the world, while over 1.3 million children are living with HIV. Healthcare officials cite various reasons on why pregnant mothers may be slacking in continuing with their medication.
And there's a variety of factors that play a role, whether it be migrating population or economic reasons or a multitude of reasons, but we say people should know. Let's make a plan, come to the facility, let's see how we can mitigate the factors that you do not interrupt your treatment because it does not have a good outcome.
South Africa has one of the highest rates of HIV in the world. About 12.7% of its population, or about 7.9 million people, live with HIV. The country has about 150,000 new infections every year. Pregnant women in South Africa can access HIV testing and antiretroviral therapy free of charge from healthcare facilities. Africa Bureau, WION World is One.